This week in Boomtown, a major Columbus area bank is making a major move. Northwest Bank telling us why it is leaving Easton for Dublin and bringing hundreds of jobs with it. Plus, Central Ohio is growing fast, but can hospitals keep up? We're taking a closer look at the healthcare expansion, reshaping the region, and what it means when you get sick. And Ohio is landing jobs, but who will fill them?
You have to focus on our people who are born here and grow up here or who live here. We can't lose anybody.
The governor wants everyone to be part of the workforce. You'll hear how he plans to build that talent pipeline. Central Ohio is booming. We all see it and we all can feel it. So here's what we uncovered this week in Boomtown. Rising up to meet the demands of a growing population. Memorial Health this week broke ground on a new $56 million emergency department. The CEO for this regional health system says the expansion will help support growth in Union County. That's expected to see 37,000 ER visits a year by 2050. We will, of course, dive deeper into why and where Central Ohio's healthcare system is expanding in just a few minutes. Thanks for joining us for This Week in Boomtown. I'm Angela Ann. Let's start with some headlines. More affordable housing is coming to Columbus. A new apartment complex by Columbus State broke ground this week with 166 units for workforce housing. Now, the rents will start at just under $700 a month for qualifying renters. In Upper Arlington, there is a new focus on helping seniors find a place to live while on a fixed income. National Church Residences received a $4.5 million tax credit for a new mixed-use campus. This will include some more green space, as you can see. NCR also operates several senior housing communities from Dublin to Grove City. Plus, Northwest Bank is moving its headquarters from Easton to Dublin. The bank says it plans to take over 75,000 square feet at Bridge North, bringing hundreds of new jobs to that area.
We will be the second largest company headquartered, or Fortune 500 company headquartered in Dublin. Provides a lot of opportunities for us to continue to grow within Dublin and provides additional opportunities for Dublin and Northwest to work together into the future.
So this ribbon cutting, very exciting for Northwest, which recently opened its first financial center in New Albany. The company says it plans to build 4 more in and around Columbus by next spring. Well, this week, Governor Mike DeWine and Lieutenant Governor Jim Tressel went to their Heart of Opportunity tour. It's a celebration of Ohio being recognized as the #1 state for business by CNBC. Now, this is a ranking we have never held. And 10 TV's Kevin Landers went with the governor on his visit this week to Arsenal One in Pickaway County. He explains why there is such a resurgence to build and invest in the Buckeye State.
In order for Ohio to sustain its growing job base, Governor Mike DeWine said everyone needs to work.
We can't lose anybody.
And he means everybody.
We have more people with disabilities today who are actually working.
And he says there are those who are behind bars who will need jobs.
We have to look at the 18,000 people that come out of our prisons every year.
At the Heart of Opportunity tour hosted at Anderl, the state's largest job creator, presidents of Ohio State and Columbus State emphasized the importance of aligning their curriculums to help provide employers with a skilled workforce.
43% of Ohio State graduates now are STEM graduates. We're going to be 51% by next year. So we're making a big push in the STEM disciplines which will power our state.
Columbus State touted its Earn and Learn program that started 15 years ago with 2 companies.
We're 15 years into that program now, and it really has created an ecosystem that's repeatable. We've got over 30 companies now that are part of the Modern Manufacturing Work-Study program.
As successful as the programs are, companies looking to grow in the state are finding it hard to find skilled workers.
We need people to build our things.
Anderl says it chose Ohio over every state in the country because of what it called the density of talent here within an hour's drive of its Pickaway County campus. It says to sustain its plan to build 5 to 7 more buildings for its autonomous drone production line, the state must continue to invest in both people from four-year colleges and technical colleges.
We have, within an hour's drive, northwest, east, south, the workforce that we need over the next few years. But that's not what delivers this outcome. That's not what sustains this outcome. We have to rely on the ability to keep delivering those students, keep delivering the curriculum that bring the skills in that we need based on what we manufacture today.
Well, speaking of opportunities, we turn now the spotlight to Central Ohio's hospital systems. This week, the CEOs of all 4 major hospitals came together for this summit sponsored by Columbus Business First. They talked about the expansions that we're all seeing in healthcare today and how those are reshaping where healthcare is delivered across the region. Now, we wanted to get more insight into this growth of hospitals, so we're so glad to welcome Jeff Klingler, President and CEO of Central Ohio Hospital Council. Thanks so much for being here on This Week in Boomtown.
Thank you for having me. I appreciate it.
This is such a big conversation because I know just where I live in the Northeast Columbus area. A few years ago, I saw one hospital system come in and then suddenly everybody else followed.
Right.
What's going on?
Well, those are the parts of our community that are growing. Right? We know that over the next 25 years, we are going to see substantial growth here in Central Ohio. The Mid-Ohio Regional Planning Commission estimates 30% growth in our region's population. That's 750,000 individuals coming into our region over the next 25 years. And I try to think of that in different ways. What does 750,000 mean? It means 82 people moving to Central Ohio every day for the next 25 years.
Wow. So these hospitals are going based on growth, not so much competition with each other.
Absolutely. They look at the growth data. We look at the aging data, where our community is aging. They look at their own internal data to find out maybe where folks are coming from to receive care, and are there gaps? Are there opportunities to get that care closer to home? And so that's why you're seeing growth in many of those areas, because that's in those pockets, because that's where the growth is happening.
So let me ask you this then: can our healthcare infrastructure keep up with that growth? Because you talked about where are the gaps.
Yeah, absolutely, but it's a long-term process, right? It's when you talk about some of these new towers that are opening up, that process can take 10 to 15 years from the time they start planning to the time that facility opens. So it is a long-term process these hospitals undertake to look at the data, to find out where the need is for the community, and to provide those services where they're needed.
While they're competitors, Jeff, they are collaborators through the council and through the work that you guys do. Where do you think they need to work together more as we see Central Ohio grow?
I love the collaboration. It's uncommon. You don't see this level of collaboration among competitors in other parts of the states or other parts of the country. But I think for the time being, we're going to focus on some of those key drivers that we're seeing now: the behavioral health, the number of individuals that are coming into our emergency departments who are in psychiatric crisis, linking them to the services they need. Still have a very high infant mortality rate here in Central Ohio, so working together and many other community partners to see how we can work with moms, work with families, work with dads to keep those babies to see that first birthday.
We'll get to that more in a second, but I do want to ask, when we talk about Boomtown, we see these big companies that are choosing Central Ohio, names like Anduril and Intel. So how important is it that we have a healthy healthcare system to attract more big companies here?
It's so important. If you're a large organization, and I know the governor's making the road trip the past couple of weeks talking about Ohio being the #1 state for business development. What would a business look for? They'd look for good schools. They look for good transportation. They look for accessibility, affordability, all those things. They look for quality health care. And we're very fortunate that we've got 4 very strong healthcare systems that really provide nationally renowned care. So we're very fortunate that is something that these businesses look for when they're thinking about where to relocate.
You talked just a minute ago about making sure, infant mortality rates, that we do better here in Ohio. We see more babies making it to their first birthday. I do want to talk a little bit, when it comes to that healthcare access, because we have hospitals that are realigning their care based on growth. And we saw recently, I think it was Grady Memorial in Delaware County that shut down their maternity unit. So how do we make sure we meet those families where they need to be so they're not traveling farther to get that care, so we can fill in those gaps and get those babies to their first birthday?
It's an ongoing process, right? So often, regularly, the hospitals mine their internal data to find out where are patients coming from to receive care. for all four of the hospital systems, their goal are to get care closer to the patients, from the ambulatory setting to the inpatient setting to the primary care setting, trying to get that care to where it's needed. Now that's difficult for every service line, right? So you have to adjust. Communities change, communities' needs change. So the hospitals are constantly looking at that data to find out where those needs are, and they adjust.
It's sometimes such a challenge, though, because if I'm a mom about to give birth, I need that service now. I can't wait for that process.
Absolutely. Yeah. And so again, so the hospitals are looking at, what are the appropriate services for that community? Is it necessarily an inpatient unit, or is it more of the outpatient unit because those families are within a certain driving distance to that inpatient level of care? So it's all those moving pieces, and it's all the pieces that they look at on a daily basis.
A lot of pivots along the way.
A lot of pivots.
Because the growth is so fast. I mean, we're really trying to still catch up with what's coming our way. So.
That's exactly right. Those communities are growing. The communities are changing.
So, Jeff, if we sit down 5 years from now and we look back at this period of explosive growth, like, what do you think is the one healthcare issue that you think Central Ohio absolutely has to get right?
I think to get this right, you have to listen to communities. It's not, certainly you look at the data. You look at the growth data, you look at the aging data. We've talked a lot about this, but you have to listen to the community. What do the communities need? What services are needed? How far away are those services from the residents? And you have to meet the needs of the communities. I think a lot of folks don't understand these are not-for-profit healthcare systems, and they exist to meet the needs of these communities. So the way you do that is you listen to your communities. So I think that to get it right, it's a lot of listening.
So right now we are seeing new pockets of healthcare in places where there's growth. Do you think we're going to see those pockets grow even larger, farther out?
Absolutely. When I talk about that 750,000 new residents coming on the next 25 years, to put that in perspective, that equates, if my math is correct, to 20 new cities the size of Westerville.
20 new cities?
54 new cities the size of Bexley.
Wow.
That's going to have to go outwards.
Sure.
Right? So you're going to see healthcare expand outwards. And so those are all the things, again, these towers that you see don't go up in a year or two. It takes 10, 15 years to plan for that. So that activity is all happening now to plan for that explosive growth we're going to see next 10, 15, 20 years.
Which is probably why we see more of those smaller clinics in between, right? Like, it might not be a major hospital with an ER and everything like that, but it's enough to give someone that emergency, urgent care that they might need.
And that's evolving also. There's a lot of procedures that needed to be done 10, 15 years ago in an inpatient setting. A lot of those things can now be done in an outpatient setting, and you're sent home the same day. That wasn't happening for many procedures like joint replacements, knee replacements, hip replacements 10 years ago.
Isn't that amazing?
So it is amazing.
Yeah.
So it's evolving, and you have to plan for it.
Well, Jeff Klingler, thank you so much for coming in. This is such great insight as we look at the opportunities in healthcare and really how Boomtown is changing what that landscape looks like. Appreciate it.
Thank you.
And now to this. We know growth is everywhere, and the city of Columbus is moving into the next phase of overhauling its aging zoning code. Mayor Andrew Ginther unveiled the second phase of the city's Zone In project this week. It's now on display at the Zoning Gallery, which you'll find on North Front Street and open to the public. Comment on the proposal is also being collected now through October 24th, and this is really a chance for you to weigh in on how you would like to see Columbus updated zoning code, which hasn't been touched in 70 years. Now, this phase would rezone 41% of Columbus. Look at this map. We're talking about 66,000 parcels. City leaders say they want to target three main buckets: mixed-use development, industrial and warehouse operations, and also institutional campuses, all with the goal of creating more housing and better connections between people, jobs, and transportation. Well, we know growth comes with challenges and some of those growing pains, but also solutions. So we do want to hear from you. If you have any questions related to Central Ohio's growth, just send us a text, 614-460-3345. And if you're watching us on YouTube, be sure to like and subscribe. That way you can always drop a question right there in the comments section as well. Thanks again for watching This Week in Boomtown. I'm Angela Ann. We'll see you again next week.